Without further ado, I would like to introduce Professor Maxine Whittaker, who is doing some very essential work for us in the PacMOSSI team, working on integrating the issues of gender, disability and social inclusiveness throughout all of our PacMOSSI activities. Maxine, please take it away.
Thank you. Thank you very much. And hello, everybody. Next slide, please, Sally. So firstly, just to recap, last year we talked about why a GEDSI approach is important in vector-borne diseases. I will give you your own time to look at this, but this was the framework that we developed to show how gender equality, disability, social inclusiveness affects everything from prevention right through to using the tools, utilization, and then the consequences of all of that, and where these different variables can affect it. So that's useful, and we'll keep using this diagram in any of the sub-modules or work that we support you with. Next slide, please. So basically also a recap. Also, you had this survey to do, the GEDSI survey, but it was held last year. I presented very preliminary results at the last conference, but we had then the chance to analyze the 11 countries who'd actually replied. And just over the weekend, all of you, if you provided responses, got your individual report, which shows your data compared to the summary data for the other 11. And if you weren't able to respond, then you've received a summary report. The individual reports for countries are for them only, and they are not shared. But this was a range across all three regions of the Pacific, all age groups, all people who were involved, and the majority were senior people. If more than 2 people responded, then the most senior person, as they identified themselves, that was the data we used. Other things we had to do to develop the whole GEDSI strategy was a literature review, secondary data analysis. All of that has been provided in the full report you got. We had to develop then a strategy for us, but also to provide to DFAT, and a monitoring and evaluation learning framework for that. And this would be regularly reviewed. This survey was also planned to do again near the end of this PacMOSSI round. Next slide, please. So just in summary from the findings, women and people with disabilities in the Pacific are facing multiple obstacles to healthcare, limited awareness of all of the resources available to look after their health, and there's a lack of inclusive practices in most programs. Gender inequality, socioeconomic status, and geographic isolation are the key inclusiveness disparities that we found, but also cultural beliefs, age, disability, and inadequate living conditions are increasing those vulnerabilities. Many Pacific Island countries have activities underway to increase inclusiveness, both in their programs and the workplace, but there was a real gap for people with disabilities. Many of the issues around the gaps are not just for the vector-borne disease program, but more broadly for the health program or the country itself. But there is also a need for the people like you on this call to actually advocate for some change around gender equality, disability, and social inclusiveness. Next slide, please. So some suggested actions. We're going to be very action orientated today. Next slide, please. In the governance, policy and planning, there should continue to be attempts to include all diverse populations in all aspects of your program cycle and in all strategies. So that's from design through implementation, then monitoring and evaluation. Accessibility, so the acceptability of the services, the physical accessibility, the affordability, and the time that services are provided should be part of all of the planning. And we should not only look for GEDSI responsive, but also to try to transform some of these things so that we actually get a real change to equity across all programs, in line with the the Sustainable Development Goals, health for all, and leave no one behind. It was obvious that planners and implementers need to be supported to understand these drivers of inequity and exclusion, and also to recognise the impact that gender-based violence will have on women's participation, not only in the programs, but also even as staff within programs. And so therefore there must be gender-based violence processes, protocols and resources available to respond effectively. They're not in all of the countries who responded. Next slide, please. From a leadership point of view, those of you who are leaders on this Zoom also, we should be role modeling in our work, our decision making and our leadership about GEDSI. We should ensure that all people who work with us, so not just our staff, but volunteers, partners, including people like PacMOSSI, and that's also our role, to make sure that they understand the sociocultural norms that may affect inclusion of these various populations. There is a need to help support leadership development around cultural and GEDSI informed programs. And we should also make sure that we look at the safety and security, particularly of our female staff participating in field work. A lot of the respondents had something around this for in the office, but women in the field work often were not included in thinking about how to look after safety and security. Next slide, please. In surveillance and response, we should try as much as possible in everything we do to have a GEDSI lens. So try to have disaggregated data in the data you yourselves collect, but also to try to link to other data sources like census data, demographic health survey, disaster data. There's a whole range of sources of data that can help you try to identify who may need to be specifically included, special approaches to make sure that they have access to everything that your program provides and have a chance to reduce their vulnerability and address their risks. Next slide, please. In health promotion, and I note that risk communication and community engagement were areas that some of you still don't feel very confident in, but in this is a particular area where a GEDSI approach is really important. In all of your countries, there are groups who could help you, like organisations of people living with disability, women's groups, other groups, who you can work with as partners to help you understand how to address the needs specifically of these populations, how to increase their literacy in these vector-borne disease-related health issues. Youth are very important to target and also the sustainability of your program. And again, there are specific guidances that were outlined in the Pacific Forum in 2022 about how to make sure that you have meaningful engagement of persons living with disability. And they're listed below. Next slide, please. In capacity development as well, we need to make sure any capacity building initiatives we do ensure cultural and physical safety, don't reinforce even unintentionally those harmful societal norms, do include something around what that country's governance is around GEDSI and also the WHO disability inclusiveness ways, and should be undertaken to, you should also understand your staffing levels and policies and codes of conduct. Next slide, please. And then, of course, in monitoring, evaluation and learning, disaggregated data, but also use it. Many of you talked about having disaggregated data, but didn't say how you actually used it in your programs. And that's the other important part. Next slide, please. So our next steps, as I said, there's those individual reports have been sent out as drafts, and your email tells you that I'm available if you want to discuss them or add things to them. If some of you weren't able to do the survey last year, happy to send you out the survey form so you could do it now, just provide a baseline. Some countries I'll be following up to do case studies where you've particularly talked about how you've actually been able to do something to help us learn from you. At the moment, we're developing gender and disability inclusiveness checklists for training. These will be developed to be reviewed by women's groups and people with disability organisations, and will be shared. And any other support you may want, I'm happy to look at. And I think that's the last slide. Thank you.